Hey, happy Friday, everyone. I'm so happy that you are here with us today. I'm very, very excited because I'd like to introduce Nadya Northrop, the pharmacist of our community who is here to help us. I'm excited that Nadya is going to be with me because I look in my drawer. I have my drugs in a drawer today, and I'm like, I have a million bottles in there. So welcome, Nadya.
Thank you, Betsy. Thanks so much for having me on, and happy Friday, everybody.
Yes. So let's talk about, what actually should be in that medicine cabinet?
So, medicine cabinets, the original, the kind that hangs over your bathroom sink, those were intended to be in a bathroom. What was that, like 100 and some years ago, probably, when they started
Yeah.
doing it, right? So back then, what we had mainly was just tinctures and elixirs, liquid medications. And since then, pharmacy has obviously grown so much. We have tablets and capsules and patches for your skin and everything. But a lot of those things should never be exposed to the humidity that is in a bathroom.
Wow.
So I like to tell people, and this may seem a little more complicated, but I think it's a much safer route to do it this way. For sure, you should have stuff in your bathroom medicine cabinet, things that you need for first aid if you cut yourself or something. So, hydrogen peroxide, iodine, Band-Aids, gauze, adhesive tape for the gauze. You can have ointments and creams like hydrocortisone, Neosporin, calamine lotion if it's itchy, like a mosquito bite or something like that. Of course, you want to have hand sanitizer. You might want gloves, alcohol wipes, tweezers if it's a sliver, but nothing that could be compromised by the humidity. And keeping all those things I just listed in the bathroom is a good place for them, because especially if you have like a cut or something, you're going to need to wash your hands before you touch that. You need to probably wash the wound. And honestly, it might get a little gross and messy. So what's better for gross and messy than the bathroom, right?
Right.
But when it comes to things that we swallow, that can get compromised from the humidity. So for that, I recommend getting either a clean shoebox, or you can go to the store and buy yourself, one of those clear shoebox size plastic storage boxes, and keep your first aid type of tablets and capsules in there. So that would include, Tylenol, Tums, Pepcid, Prilosec, Zyrtec, stool softener, that kind of thing, cold medicine, any kind of tablet or capsule that you're going to swallow, but not every day. So it's just if you need it, like an emergency level.
Are you saying like a plastic with a top, and then it can be in your bathroom? Okay.
No, never in your bathroom.
Out of my bathroom.
I forgot to
be. This is so good. I have never even heard this before, so I'm thrilled. Keep going. This is exciting.
So I really apologize. I forgot to mention that this box that you keep all your swallowable things in should be so far away from your bathroom, like opposite end of the house. A good place is a bedroom closet, or if you have a big enough dresser drawer, you can put it in there. You want to keep it high up enough that it's not a risk to children. Even if you don't have children in the house, children could visit, that type of thing.
Right.
So I'm always a fan of keeping things up high enough. Not so high that you're going to hurt yourself reaching for it. That's some level in between. And the thing about tablets and capsules is that when they degrade, sometimes you can see that they might change color, but not everything is visible to the naked eye. And when it degrades, one of two things can happen. Well, three things. One, nothing's going to happen. Second is that it could not work as well. The efficacy of it can be compromised. And the third thing, and this is rare, but it can happen, is it can turn the chemical, the drug can change, and it can actually become toxic. So it's very important not to keep those things in the bathroom.
Right. Why take any kind of chance like that?
Right.
Absolutely not. Go ahead.
Did that help?
Yes, that helped. I have one other question about it. I have one other question about this now. People often nowadays have very large dressing areas and bathroom, so even like, like your sinks could be in one room and then your shower another, you're advising maybe the kitchen or
No, not the kitchen.
not in the
It's
kitchen.
high in humidity too. It's not it's not as high in humidity as the bathroom, but it is kind of still a high humidity area. If you have a very humid basement where you have to run a dehumidifier in the summer, that's also not a good place.
Yeah, no.
Just a cool, dry area in your house.
Okay.
If you do have, if you're blessed to have a huge master suite with a gorgeous master bath, I still wouldn't keep it near there. I would
maybe in the closet. How about a bedroom closet?
Bedroom closet should be fine. It should be far enough away. Yeah.
Okay. All right. That's good. That's good advice. Okay. Let's talk about eye drops.
Okay.
They have been all over the news. Let's talk about eye drops.
They have been in the news a lot. Overall, I still consider them safe. And in some cases, I'll get to, they're even necessary. But what I recommend for people, if you're really concerned, is buy those single-use drops. So they look like little, they come kind of strung together. They're clear plastic, and then you break one off and you kind of twist the top and it exposes it, and then you can easily just use that. But once those are opened, you have to dispose of them shortly after. Because they can quickly grow bacteria, and because in most cases the top can't even be set back on very well. So if you're going to leave it open, that's really bad. So also they really don't stock very much liquid in those, so you really will only get a few drops worth. And so if you're using it for dry eyes, you could probably put it in your eyes, wait half an hour. If you're sure it's someplace super clean, you'd want to stand it up. You don't want to lay it. If you lay it down, it's not going to run out of the bottle. You just have to store it so carefully, and make sure you don't contaminate it even in that half hour or so. That you don't have it on the end table of your sofa. Your dog doesn't come by and sniff it. It's just I believe single use is single use, and then you should dispose of it.
And tell me what these eye drops are basically for dry eyes. What kind of eye drops are we talking about?
Well, I believe the ones that were in that big recall that hit the news, those were for dry eyes. Those were what we call lubricating eye drops. And the difference is those were not single use. And you can Google eye drop recall 2023, and you can find a list of all the different ways that it was packaged, because it was a generic manufacturer that then sold it to brand stores. I think Target may have had some of them under the Target logo. So you can find a whole list of them, and I do recommend that you check and make sure you don't have them in your house. But none of them were the single use. They were all what we call multi-use vials. And the big problem is that when you make eye drops, it has to be a sterile manufacturing process. And that was not what happened with these. There was poor inspection, poor quality control. When we were in the height of COVID, and even at some point afterwards, and we're talking about these were made outside of the U.S., I believe. I don't know where, but outside the U.S. So of course our FDA has little, if any, knowledge of what goes on, right? But during COVID, and even during the height of COVID, and even in like 2021, there were less inspections being done at places because people weren't coming out, right? So all of that leads to, compromising the manufacturing process. And so that's pretty much what caused it. And what happened is that somehow a really nasty bacteria got into those, and it was a really bad bacteria. And it was in this country, we tried some antibiotics that didn't work. They finally found one antibiotic, a rather new one, that did work. But unfortunately, people suffered, before our government could figure out what was going on.
What it was, right. We're good, but we're not always that good.
Right. But when it comes to eye drops, let's just remember, follow the basics. What your mother taught you. Wash your hands, right? Wash your hands before dinner. Wash your hands before you touch your face. And we learned that during COVID, right?
Right.
But wash your hands before you do anything related to your eyes. And that includes applying makeup, rubbing them because they're itching, because it's allergy season, or whatever it might be. Just always wash your hands. And then when it comes to the drops, never ever use expired products. That's a huge no-no. And never, another huge no-no, never share eye drops. Okay. And then you want to make sure that you don't touch that dropper surface to your actual surface of your eye, or even like the inside lid. And that can be difficult for any of us. I'm not going to take my glasses off, but you can imagine my glasses off. If I tried to put eye drops into my eye, you know, you have to get them close enough so that you're going to get in there. And then when you think of being a senior and doing that, some of the issues that come into play for seniors is that they have a higher chance of having medical conditions that can make it harder. So if you have arthritis in your dominant hand, or Parkinson's, or a Parkinson's-like tremor, that's not necessarily Parkinson's, there are other types of tremors, you know, all of that can make it much harder to hold on. And those bottles are small. They're not holding something big. You're holding something really small. So all of those factors come into play. You know, you just have to work with it.
It's somebody else. I know, with my husband, my son needed eye drops, and we did them for them, you know, and, you know, just we're very careful. But, you know, it's great if you have somebody that can help you. That's really all good information.
Well, let me just say one more thing.
Okay.
So all those things that we just talked about, making sure you do and don't do, those are a much more likely cause of an eye infection than the recall. Overall, things are still made pretty well. It's really the end user problem in a lot of cases. And the other thing I want to say is, if you're using a prescription medication, those a lot of times you should not stop those, depending on what it's for. But if it's a prescription, for example, for glaucoma, if you've been using them regularly and then all of a sudden you see this on the news and you get scared and you stop, the pressure in your eye can get really high, and that can cause problems and can even lead to some vision issues. So don't stop them just because you see something on the news that scares you.
That's really, thank you, Nadia. That's really, really important. This is not that. If you've been prescribed something, take what you're supposed to take. Call your doctor if you have a question. That's really important. Now, you know, I've heard about seniors have more problems with medications and reactions than younger adults. Is that true?
Yeah. So, you know, as we age, we find more wrinkles and gray hairs, but we're also aging on the inside.
Yeah.
And, you know, some of the things that happen, for example, is our kidneys slow down. And so at some point, some seniors will need their medications adjusted, and which means that usually the dose will have to be decreased at some amount. And that's something that the doctor needs to do. So that's one problem. There are other things that happen in the body due to aging. But another big problem for seniors is something called polypharmacy. And polypharmacy, the definition of it is taking 5 or more chronic medications every day, chronic prescription medications every day.
Right.
So, Betsy, there are so many people that are on more than 5 prescription medicines.
Oh my God. You know, absolutely.
I mean, just think of, you know, and the more medical conditions you have, the more prescriptions you're going to be on, right? So you have diabetes, cholesterol, blood pressure, thyroid, and I don't know, another one, Parkinson's. There you go. There's 5. And those are 5 you're going to be on every day.
Right.
So one drug can cause certain side effects. And then when you're on 5 or more drugs, you have some of those side effects are the same and some of them are different. So you have all the different side effects. Then you have drug interactions. So we think of drug interactions, we think of a drug interacting with another drug, but drugs also interact with food. They interact with alcohol. They interact with food like dairy products in some cases, grapefruit juice. That's a common one for cholesterol medicines.
Yes.
There's a medicine Get this. There's a medicine that interacts with black licorice.
Wow.
I mean, how many of us eat black licorice? But it's just an example that there are a lot of different interactions. And then the drugs also will interact with a medical condition. So for example, if you have high blood pressure, there are certain cold medicines that you shouldn't be taking. At least not without your doctor's permission.
Right,
So your doctor knows
right.
where you are with your blood pressure control. If you have asthma, there are certain heart medicines you shouldn't be taking. So all of that, that all plays into affecting a senior's health and what happens when they take medications. But another big thing is that, remember this, polypharmacy, 5 or more drugs, can also it increases fall risk. So, and a lot of that is because of the side effects. So if you're on medications that cause dizziness, confusion, blurred vision, any of those things are going to make you more likely to fall. And then the other thing is that polypharmacy also leads to something we call non-adherence, which is a fancy word that basically means not taking your medications the way you're supposed to.
Because it's too complicated, overwhelming, it's too much.
Oh yeah, for sure. Because none of us, whether we're seniors or younger adults or whatever, there's a point where we tune out how many instructions we can actually follow.
Absolutely.
Right?
Absolutely.
And you don't have to have any kind of a medical condition that would affect that, like, ADHD or something. I mean, just your average person has a limit as to how many instructions we can follow or even want to follow. Some little independent streak starts to show or something. I don't know all the research behind it, but for sure there has been research done that plays a role. And the problem with non-adherence is that 50% of adults are non-adherent to some degree. And this is so sad, up to 125,000 preventable deaths per year in the US are due to non-adherence.
Wow. And just non-adherence to taking their medicine.
Well, non-adherence has a bunch of facets. It can be, you can get a brand new prescription from your doctor and you decide not to fill it. That's probably one of the most common ones.
Right.
And then there's stopping your medication without talking to your doctor or your pharmacist, just deciding to stop it, or forgetting to take it, or taking it incorrectly. Those are the most, and some people stop it because they think they can't afford it.
They can't afford it.
Yeah.
But it's still, that is a very, very large number around medication. We're not talking about non-adherence to quitting smoking or stopping drinking. That's also some kind of, it's going against medical advice. But these are just because they can't afford it. They don't know what they're doing. They forget. They don't, around medications.
Correct. This is just medications.
Yeah. Which is a lot easier than to quit smoking. If you put it in, take your medicines and quit smoking, it's not as, you would think people would take their medicines, but they have a thing.
A lot of it is, some of it is intentional, especially with the cost issue. People say, this costs too much, I'm just not going to take it, right? But a lot of times it's not intentional. We just, like, forgetting's not an intentional thing. And you don't have to have dementia to forget. I mean, forget. So forgetting and just not understanding how to take it. And that's why it's so important to get that clarified either with your doctor or the pharmacist. Somebody, make sure you understand. And if you don't, call somebody and ask.
So
call your pharmacy, call your doctor's office and ask for the nurse. And make sure you understand.
We're going to get into that in a second, because calling your pharmacy is not such an easy thing to do.
No, it's not.
If someone said I had to call my pharmacy right now, I would say, no, I do not have all day to call my pharmacy. It's a very long process. And I know you have an alternative to that. And I want to talk about that because I'm a perfectly healthy 65-year-old and I do not want to call the pharmacy. So having said that, I looked in my bathroom where all my medicines are, which I guess I need to move them. I have bottles and bottles and I don't even take anything. And I'm thinking, what is in here? This has got to, this is not good. So Can you sort of speak to that a little bit, both of those?
So that you have so many bottles and
I have so many bottles. Somebody should go through those bottles and say, get rid of this and how to get rid of it. I guess I have to take it over to,
so
yeah.
yeah, you want to make sure that the medications that you have in your house are ones that you actually need to take. A lot of people store stuff for literally years. And, we talked about how humidity can cause
Right.
medications to degrade, but time also. There's an expiration date on the stock bottle at the pharmacy. That expiration date does not get transferred to your little orangey brown colored bottle when the pharmacy fills it. But the general rule is that you shouldn't use things more than a year after the date the pharmacy filled it. So your
Okay.
bottle will have your name and the name of the medication, et cetera, and it'll say fill date.
Mhm.
And so if you go through that drawer and you find stuff that's more than a year old, you should probably get rid of it. Yes, there are drug take back days in most communities. You can just probably Google it for where you live, your township, and they'll take those medications back. Do not flush them down the toilet.
Thank you.
Because somehow it gets back into our system, which I don't like thinking about the
Yeah, because
the idea that what flushes down the toilet somehow comes back to us.
right, right, right. But that is not a good policy. And I think you need to say it here and now. Do not flush drugs down the toilet. And I think Walgreens has boxes there and it says what they don't take, but they take most. I mean, I'm sure if they filled it there, they take it.
Well, I think I'm not sure exactly what they take, but there are other issues that come up. So, for example, if it's a simple blood pressure or cholesterol medicine, that is probably something they'll take back. But if it's a controlled substance like a morphine painkiller, they probably don't want to take that or can't take that back. I'm not sure what the latest laws are on
Right.
that. And then also, you want to make sure that you don't leave stuff like that around. You just never know who could be in your house and see it. And I don't even want to talk about the stories I know and have heard over the years, relatives taking it from,
Yeah.
people and then selling it on the street. I mean,
Right.
those
Yeah.
things have street value.
And I will say right here as a realtor, we counsel our sellers to remove drugs from their homes, to lock them up, take them with you, and I put them in a little bag and carry them out with you because we don't want that to be a temptation or someone to fool with you just never know. And it's a problem.
Yep.
So we have to be very careful about that. Okay, last item. Let's talk about vitamin D. Just give us what you think of vitamin D and how much we should take, and can we take too much?
Okay. So in this part of the country, we've had beautiful weather, by the way.
Yes, yes.
Oh my God, am I thankful. It's
Right.
lovely out. But it's changed. It's gonna change. It's gonna go away very soon. So in this part of the country, we do experience less sunlight for a fair amount of the year. And so the standard recommendation is that you can take 400 units a day, supplementing in the fall and winter, and that should be fine. But I like to suggest an extra step, and that is just you probably shouldn't need an appointment if you've been seen recently. Call your doctor and ask them if they'll order a lab test. It's a simple little stick in the arm and find out what your level is for a couple reasons. One, if it's low, your doctor can help you figure out how much you should take to get it to bring it back to a good level.
Okay.
And two, not all of us are vitamin D deficient. And so you don't want to use it if you don't need it.
Mhm.
But if you do need it, like if your level is low, and low is anything under 30, vitamin D is really important for so many reasons. And people who have a low vitamin D level, there has been enough there have been enough studies to show that there's a correlation between low vitamin D level and cancer, depression, bone health, obviously. That's a big one people know about. Diabetes, heart disease. So, it's something that's easily fixable,
Right.
but you want to make sure that you actually have a low enough level that you need to raise it. Because if you don't need it, you shouldn't take it. And then the other thing is that there's been some research now that you should take vitamin D not by itself, but with vitamin K, but you don't need that vitamin K in the tablet. It's actually, there's a theory that you can just get it from diet. So real quick, it's not vitamin K1, which we think of like leafy greens. It's vitamin K2, which is a little bit harder to find. It's present in high-fat dairy like butter and some meats and egg yolks. And if you're watching your cholesterol and those aren't good for your diet, you can also find it in fermented foods like sauerkraut and kimchi. But one last thing, if you do take the older blood thinner called warfarin, where you are told to watch how much vitamin K you take in, you have to treat this vitamin K2 just like you would treat the leafy greens in terms of the advice that your doctor gave you. And so if you introduce this into your diet and you haven't been eating much of this before, then you would want to have your special blood test called INR retested just to make sure and that everything's good. And that's it.
Wow.
And then just can't wait for springtime, right?
Right, right. But you know what? I do want to go back. So tell it, because what you do is really unique and special. So let's just take a few minutes and talk about how you can help anyone, especially seniors, but you can do this for anyone. So let's talk about how you can service our community, what you do to help.
So I am a pharmacist with over 20 years of experience. And what I do now is I have my own company, and I come into the homes of primarily seniors, people who are on a lot of medications. Usually it's seniors. And I sit down with that person, and oftentimes, as long as it's okay with them, maybe their adult child. And we go through every single bottle, like your drawer full of bottles. We go through every single bottle. I make sure that they first we filter through what's not what they shouldn't be taking anymore. Then I make sure they understand, this is your Lipitor. Do you know what it's for? Yes, it's for my cholesterol. Yay. We can, but we go through every single drug they're on to make sure they understand what it is, why they're taking it. And then some common things that might happen that are, common side effects that might be okay. And then side effects that are, time to call the doctor. Which hopefully doesn't happen, but you need to be aware, right? Because it could. And then I also look for drug interactions. And so a lot of it is patient education and a lot of evaluation. And, I have great respect for all my colleagues at Walgreens and CVS and all over. But they just, unfortunately, they don't have the time to sit down with people like this. And people are so thankful once they've met with me. They understand so much more. I also produce an updated medication list for them, which it is so important if you are on multiple medications. Even if you're on one medication, you want to know what you're on, the name, the strength, how often you take it, and the prescribing physician. Those are probably the four most important things that should be on there. And so that they can carry that medication list, and they should take it with them to any appointment where there could be a prescribing opportunity. So even a regular doctor's visit or a specialist visit, and then unfortunately, God forbid, the emergency room.
Yeah, that's what I'm thinking. If you have that with you, depends what hospital you end up in. They may not have your chart. They may not know. They may not, so if you have that with you and you can't talk to them, it should be in your purse or in your wallet or someplace so that they know that you're taking all these medicines, because they could give you something that is absolutely not going to work with something that's in your system.
Correct. And that's what we're right. You know, it's bad enough to end up in the emergency room or even overnight, a few nights in the hospital, but it's even worse to be put on a drug that then interacts with what you have at home and be what's called readmitted or rehospitalized. So yeah, you don't want something.
And it's no secret that there are concierge doctors now, and Nadya is here to help, because we no longer have our family doctor that we go and, Marcus Welby isn't around anymore. So thank goodness for you, and people should reach out, and because this is totally preventable. You can come over, do a few visits with people, make sure that everything is going well, and set them on the right path, and then maybe come back in 6 months, make sure everything is still good. But instead of things going awry and then saying woulda, coulda, shoulda.
Yeah, no woulda, coulda, shoulda. It's much better to prepare ahead of time, and and I'll make recommendations, and I provide an after visit summary that has all those recommendations, and I spell it all out for them, exactly what I think you should talk to your doctor about. If I find something I haven't found anything yet that's really, really dangerous. If I did, I would offer to call the doctor right then and there. Oftentimes it's more like minor to moderate drug interactions, not major. Those are the 3 categories. But even so, I mean, minor to moderate can be, enough of a problem, especially in seniors. And again, fall risk, there's just so many issues.
So many issues.
And a fall prevention visit that's based on a pharmacist's perspective.
Yeah, because I think a lot of this is going on that you don't even know about, because we've lost touch with what's really happening, because we live in such a fast-paced world. And I know with the holidays coming up, this is a time when you're visiting with your family. Maybe you haven't seen mom and dad in a while, or uncle so-and-so. You think everything is okay because you talk to them on the phone and they go, hey, yeah, hi, how are you? Fine. How's everything? Fine. Now's the time to really take that extra look and maybe think about calling Nadya and making sure that at least their medications aren't causing them to fall, or there's not something going on.
Absolutely.
So, well, thank you. Any final words?
No, just have a lovely weekend. It's going to be
yes. Everybody enjoy this gorgeous weather. Thank you so much for talking about all this. This was so interesting and so needed. And it is sort of new because, we just trust, and we have to, life has become too complicated.
And I think that's, it's not that you can't trust your doctor.
Right.
I mean, these doctors are wonderful. They're smart. They're good. They're caring people. We're all pulled in so many directions, right?
That's what it is.
And the doctors now, unless you're in a concierge practice, if you're going to a regular doctor, they're expected to see X number of patients per hour.
Right.
There's a productivity equation kind of thing going on at your doctor's office.
Right.
And, they're human. There's only so much they can focus on. Now, I'm not saying they're going to make a mistake. I'm just saying there's only so much they can focus on. Even,
right. That's true. And, it's just the world has become very, very complicated, and the computer systems and everything has made, I get this medicine and Walgreens packs it in like a vault with so many pieces of paper. And so that it is overwhelming. Then you just throw everything out and you don't want to read any of it. So maybe there was something I should have read, but it's a lot. Yeah. So we are fortunate to have professionals like Nadya here in our community that can help us get through this. So thank you. Thank you, everybody. Have a great weekend.
Thank you, Betsy.
Thanks.
Bye.
See you next time.
Yep.